Vomit here, and welcome back to Vital Knee Surgery. Now, that one doesn't have quite much of a ring to it, but we're going to be playing this random flash surgery game. I don't know, it looks fun, so let's just get in. We're going to be a professional doctor in this episode.
Welcome to Virtual Knee Surgery. This activity will show you the process of replacing a failing knee joint.
There's voice
Are you
acting!
ready?
I was not expecting
Today,
that.
our patient is a 76-year-old man.
Okay.
It is mandatory to check the patient's vital signs before beginning surgery.
Listen, I've played
An
Surgeon
anesthesiologist
Simulator,
in the
so
operating room performs this
just
step.
call me a professional
If the
doctor.
patient's vital signs are not in the normal ranges,
Okay.
we will not proceed with the surgery.
We will not proceed with the
Using the
surgery.
healthy person's vital sign chart as a reference, can our patient undergo surgery today?
Okay, so his temperature is in between 97 and 99, and his is 98. So, his temperature is fine. His heart rate is 75 beats per minute. And a normal heart rate is 60 to 100, so yes, he can there. Blood pressure lower than 150 is fine. And lower than 100 is fine. Okay, so that is fine again. And as long as it's above 92, so yes.
It looks like surgery will proceed as
Okay,
planned.
good.
Take a moment to look at our patient's x-rays.
Okay.
Which knee do you think needs surgery?
Maybe the one on the right? What do you guys think? Because maybe, I don't know. Actually, maybe the one on the left. It looks like there's a big gap.
Sorry, his right knee appears fairly normal. His left knee
Okay.
appears worn down and lacking cartilage, which is likely the
Okay.
cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand.
Okay.
Now it's your turn. Use
So-
the marker and write your initials on the proper knee to be operated on.
Okay,
This may seem
right knee,
silly,
right?
but it's an actual step taken to prevent wrong site surgeries.
Okay, so right knee, our initials. So we're gonna do Bon Bit. There we go.
The anesthesiologist administers drugs through the IV
Okay.
and through a mask over the patient's face.
Okay.
What function should these drugs perform?
What junctions are these? Probably to make it from feeling anything, right? That's what I would think. Which one of these does that mean? Surely it's... Oh, 3 that apply. Kill the pain. Oh, you mean no? Shut up. No. Which one would it be?
Nope.
What?
Great. Good work. Fantastic.
Wow,
After the
you
patient
did
is unconscious, and
fantastic.
before the first incision is made, we need to establish a sterile
Okay.
field around the surgical area. A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood
Tourniquet?
flow, which allows a clearer
Alright,
view of the
okay.
surgical field during surgery. To
What
kill
is
the
that?
bacteria on the patient's leg,
Ew.
clean it in a betadine solution.
There's coffee with
This
ice in
scrubbing
it.
process will limit the chance of bacterial
They
infection.
put coffee inside his wound. Oh no. Grab the sponge from the toolbar below so we can swab the leg with the coffee water. Okay. So I don't have to go like this and then go... He just put a little fake tan on his leg. Okay, then. Now what? I have to do it everywhere. Okay.
The betadine scrub is applied 2 more times, followed by the
Okay, so
final
now you have a
arrangement
cast.
of sterile drapes.
Okay. Is this just to keep the leg in that position? Why do you think knee surgery involves so many drapes? To keep the patient warm and in frigid, to protect the patient's new prosthetic from hard to treat infections, to protect the OR staff from infection. It's a hospital fashion trend. It's gotta be it's gotta be that one.
Good work.
Thank you. Okay.
Use the sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too. Typically, the incision line is 6 to 7 inches long.
Okay, so what we're gonna do is, I'm guessing it don't matter which order we do them in, right? We just have to draw these lines. Boop, boop. Yeah, we did it.
What purpose do you think the perpendicular lines serve?
To help align the knee, to indicate which knee needs surgery, to increase sterility around the knee. This is actually a good question. I don't know. This
Nope.
one. This one.
Nope. No. Outstanding. Now for the incision. Take the scalpel and cut the skin following
I got
the
them all
markings.
wrong. What do you mean outstanding? I should not be performing surgery on this man's leg. I got all the questions wrong. Grab the scalpel. I don't want to do this.
Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field.
I don't even know. What does the Bovie do? This is disgusting. What do I have to do? Ew. I don't like it. It's so disgusting.
The rake retractors fold the skin and tissue out of the way,
Okay.
exposing our patient's knee.
Is that
To
really what
operate,
they do in
we
real
need
life?
the
I don't like
patient's
that.
knee elevated and bent so the bones are fully exposed.
I don't
now
like
the
this.
legs at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL,
It's
the
disgusting.
meniscus, and any bone spurs that may be lurking about.
Okay, what do we need? The rover, the ronger. So what do we do with this tool? Oh, we cutting his bone off. Where else does it need doing?
Are you a good sculptor? It's time to shape the femur,
Oh no.
tibia, and patella so the new knee components fit properly.
Okay.
A hole must be drilled inside the femur to set up the distal
I don't
femoral
like this.
cutting jig and alignment device.
Even though you're asleep, just waking up knowing that someone's been drilling your knee bone. It's so like, Grab the drill from the toolbar, then click the center of the femur to drill a hole. Is the femur the top one?
The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed.
Did you see how long
now,
that was?
hammer in the pins to hold the jig.
There's no way. I don't believe that you just hammer nails in your knee. Surely not. I don't like it. It makes me so uncomfortable feeling.
We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping.
This is
Use the bone
disgusting.
saw to cut the bone so it is prepared for the new femoral component.
No, what if I mess up? What do I do?
Another cutting jig, along
don't
with the bone
like
saw,
this.
allows us to finish shaping the femur.
It's horrible. It's actually so uncomfortable watching it.
Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia.
Okay.
This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins.
Why pins? It's disgusting. Bang, 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 bang.
Use the bone saw to cut off the top of the tibia and prepare it for the new tibial components.
Alright, I'll just cut up your knee like it's a piece of wood. Sure. There. Oh, do you need some more lumber? Well, here's the wood. Just cut down the tree. There you go.
Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella.
Okay, we need the patella jig. This. I don't actually know what this is. What's this? What are we going to do with this? Are we just going to cut this off? What is it? What is that? I actually have no idea what that is.
Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial components. First, attach the femoral trial component.
Femoral trial this. Okay.
Attach the metal tray trial component to the tibia.
Metal tray component. I can't believe this is what happens.
Insert the plastic trial spacer into the metal tray component.
A plastic spacer.
Lastly, attach the patellar trial component.
Trial. This. Wow.
Why do you think the two tibial components are inserted
I
separately
can't believe
instead of
if
as
you
one
get a
unit?
replacement knee, that's what happens. Because you're gonna have to let me know if that game is accurate to what actually happens. That is a new fear I never knew I had. It makes me so uncomfortable. Okay, why do you think the two tibial components are inserted separately instead of one unit? For cosmetic reasons, the parts are sewed separately. They're easier to insert one at a time. The plastic scraper can be replaced. Yeah, definitely that one.
Fantastic. Conduct a range of motion tests to assure proper knee alignment and successful prosthetic fit. Typically, a normal range of motion allows the leg to move from 0 to 130 degrees.
Okay.
How does our patient's range of motion look?
0, 130. Good.
Knees aren't meant to bend sideways.
Okay.
So it's important to determine whether there is a gap or space between the femoral and tibial components.
Okay.
There's no noticeable gap, so this knee is a good fit.
Good.
Why do you think there are so many steps taken to ensure proper alignment?
Faulty alignment can produce many complications for the patient. Definitely that. So the knee doesn't bend backwards. To provide time for questions, so the knee, definitely the first one. Good.
We've tested the trial components. Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone.
That wasn't even the
scrub
real
technician
one.
has mixed up a batch of cement for you to use.
Grab the cement from the toolbar. Click on the prepared surfaces of the femur, tibia, and patella on. Spread down the cement. Okay. I thought they was the real ones. Oh, we put them in and took them back out.
With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away. Lay the leg flat on the table so the new knee components put pressure on each other. This allows the bone and components to bond with the cement. The cement can take anywhere from 10 to 15 minutes.
I thought it'd take a long time.
We perform our range of motion tests one final time.
Okay. Good. And good. Basically just a qualified doctor now, right?
Patient's new knee is looking good. Let's close up the incision. First, suture the deep tissue and fat layers back together.
Okay, suture. What does that even mean? What is this? We're sewing it together.
For closing the surface incision, you have a choice between the stapler and the suture.
What should we do? I feel like this is being more safe, right? I don't want my legs stapled together with like office stationery.
What is the primary difference between these two methods of closing the incision?
Strength. Probably strength.
Nope.
Staple causes less scarring, maybe?
Excellent.
Okay.
You know, we couldn't ask for a better participant. You've done an excellent job.
Yeah.
Are you sure this is your first total knee replacement?
Sure.
Our patient will remain in the hospital for 3 days, followed by 3 to 8 weeks of physical therapy. Because of this surgery, our patient will have significantly reduced pain and increased mobility. Before you leave, let's think about the life of the new knee components. What kind of forces do you think the new knee will need to withstand?
Surely 5 times.
Nice job.
Good.
People average about 5,000 steps per day.
Really? I thought it'd be
Our
way more
patient's
than
new
that.
prosthetics will withstand a great deal of force for 36 million steps or more.
That's a lot.
I'm off to check on another patient while the OR team prepares the room for the next surgery. You've been a great help. See you next time.
Yeah. That's terrifying. And his mouth's still talking. I think what he's saying is, hey, you guys should totally like the video right now and subscribe. It really means a lot. And we can do more surgeries. I'm just kidding, but that is the end of the video. If you guys did enjoy, please consider leaving a like or subscribing. It really means a lot. And I'll see you tomorrow. Goodbye! Yes! We did it! It's so loud! No! Ah! Someone's there. The power goes down so fast. No! Freddy's there! Too far back. Come on. Yes! We are truly lost in space. I don't think we're ever getting back. Oh! Body's coming! Run! Run! I can't remember which way he comes from. It's down there.